Good evening, everybody. You're all very welcome.
Hello, good evening.
We're all looking forward to this, Nina.
Yeah, it's been really fun putting this one together, actually. I wouldn't say my partner would say that because I'm now telling him, what he needs to be doing all the time. But I think I was already, so.
I was thinking, yeah.
Yeah.
Well, my husband's going to watch it tomorrow. So
Well,
I was
that's a
trying to
great
get
thing.
him come up. Yeah.
Yeah, about the replay, isn't it, as well?
Yeah, he likes that in his own time. So
I think sometimes as well, especially with like ones like tonight, there's quite a lot to cover. So it's a bit of a whistle-stop tour because I'm thinking I want to be as impactful as possible, but it's a bit of everything. So sometimes it's quite nice to stop and start it as well, isn't it? And just take it in.
exactly. You're very welcome, everybody. Welcome to the NSK Ikigai webinar series. Tonight, we're delighted to have Nina Farmer back, and tonight it's all about men's health. So whether we have a lot of men on, I'll have a look there in a moment, or your partners, or indeed any of your family members. Thanks very much for approaching this, Nina, because I don't think there's enough about men's health. There's a lot about women's, isn't there? So some of you will know Nina, that she's actually a dental therapist and she's dual trained then as a dental nutritionist, and she'll explain more too. So I'm going to hand you straight over to Nina, and you can make a start, Nina. Thanks very much.
Thank you. Right, so thank you everybody for attending this evening, especially we've not quite got the daylight yet, have we? So coming and spending the evening with me, I really appreciate it. So yes, what Siobhan just said, spotlight on men's health. I was actually really thinking this is a very not talked about subject, and I'm actually really delighted to be talking about it tonight with you. So we have my aim tonight is to empower men with the knowledge to enhance their health through informed dietary choices. So we're going to address the unique nutritional needs of men, focusing on how nutrition can prevent disease and support overall well-being. Now, just to bear in mind, obviously, we all have the same bodies, and there is going to be a little bit of repetition perhaps from the webinar that you watched last week if you were there. But hopefully you'll be able to go a little bit deeper with it, and it'll resonate with you as well, because we all have the same bodies, and but we also have the same people in our lives that we want to look after, also as well our patients as well. So our objective, we're going to describe what a balanced meal or snack should look like, the nutrients needed to assess how portion size for oneself and physical needs, explain the impact of poor nutrition on the male body and the associated health risks, understand the effects of blood sugar imbalance and stress on the male body, discuss safe supplementation and need for functional testing, and plan who and when to seek help if further support is needed. So what I thought would be a really good place to start is with some statistics, because I was thinking, right, well, what am I going to do in this hour, and what are the main points that are going to really sort of help the people watching? And I thought, right, let's have a look at the statistics. Let's see where the real need is. So I had a look at sort of NHS England Digital, and went on to prostate cancer and the Mental Health Foundation, just found some really significant things that are sort of significant to men. So a higher proportion of men than women were either overweight or obese. So that's 69% more compared with 59% of women. A high proportion of men than women drank alcohol at increasing risk levels, and that's 28% more than women. More men than women reported that they currently smoke, so that's 13% of men, 10% of women, so it's a little not too different there. And the most common cancer in men is prostate cancer. So more than 50,000 men get diagnosed each year. More than 12,000 men each year die from this prostate cancer every year. And 510,000 men are living with it, and 1 in 8 men in their lifetime will be diagnosed with prostate cancer. So I thought there were some really good statistics there showing around that prostate cancer risk. 3 times as many men as women die by suicide, and that is usually around the age of 40 to 49. It's the highest in the UK. And in the flip side, it says that men are actually less likely to get psychological sort of services. So when you look at the referrals, there's 36% of them are only from men, from the NHS, for talking therapies as well. And then finally, just to end on the life expectancy. So women have 4 years more than men, with men at 78.6 and women at 82.6. So yeah, some sort of real statistics there for you. Now, I had a little look at this, and this is the sort of the Movember report. And again, this is endorsed by the NHS, and they share it on their websites as well. There's this huge report on men's health and men's perception of health. And something that really came through to me, that was there was a lot of preventable sort of diseases that are causing young men to die. And a lot of this often is actually because they're not going and having conversations with healthcare, or they don't have the same opportunities, and they don't necessarily feel they can have those conversations. And that they don't always feel that they are feeling welcome. So another study concluded that men find general practice unwelcoming and accommodating, and that they also experience psychological barriers that impact engagement and help seeking. And they probably view general healthcare more as an acute place to be rather than preventative health and care. So I thought that was really interesting. And I was also thinking then, well, what about our patients? I've named this patient Bill. I don't know if you all see him as a Bill, but he's Bill to me now. And it sort of really made me think about, you know, our responsibility as dental professionals, how we can hopefully break that barrier with our male patients as well, get them to feel comfortable and talk to us. And we are going to come back a little bit to Bill a bit later on things that we could probably see in our male patients that, you know, could perhaps get that conversation started and get them signposted. So just to follow on from that, there is the Making Every Contact Count initiative with the NHS. I don't know if you've heard it or not, but it's an initiative basically to anyone that works in healthcare and has exposure to patients, to get us talking to them about nutrition, obesity, smoking, alcohol, exercise, stress, and being able to signpost them when we can. Now, in Derbyshire, where I work, we have a Live Well clinic. So I send a lot of my patients information on that, and they help with smoking cessation clinics or even obesity clinics as well. And that can really help them as well, because maybe they don't feel like they're going to the GP and it doesn't feel so serious, but I've had some patients have some really good results with those as well. So the things that have really come up from those statistics that we've got, isn't it? We've got obesity related illnesses are a risk to our men. So things like cardiovascular disease, high cholesterol, high blood pressure, and diabetes. Now, women are catching up with the cardiovascular around sort of menopause age, especially when we get that decline in estrogen, but men are still ahead of us in these sort of obesity related illnesses. So we're going to focus a bit on that tonight as well. Prostate cancer, so that came up in the statistics. So we're going to talk a little bit about that tonight, especially as we sort of know that 1 in 8 men may have this diagnosis. So we can look at the, you know, maybe some of the nutrients or the eating sort of styles that can really help with prevention of that. What's the research behind them? Mental health as well, with the suicide rates being at what they are, I felt that we should really talk about, you know, mood foods, what we can do to boost moods, and also maybe support the central nervous system as well. And it would not be a men's health workshop, would it, if we didn't talk about testosterone this evening as well. And we're going to talk about something called andropause, which is the male menopause as well, if anyone's actually heard of that. So let's start at the beginning. This is our endocrine system, and this is really just going to kind of highlight how linked everything is. So it's a messenger system. It's got all of our hormones, and it releases hormones to other parts of the body to get them to form some function. And it's really responsible for growth, metabolism, reproduction, mood as well. And you can see here that we've got, so it should say the hypothalamus at the top, because that's our mother gland at the top. So hypothalamus. So it starts with the hypothalamus. And then, for example, for the stress response, it's called the HP axis. It's hypothalamus, pituitary gland, and adrenals. And it'll go down that path for the, you know, the hypothalamus, pituitary gland, and pancreas for insulin. And then obviously that further down, it will do the same for the testes for testosterone. Now, they can all impact each other. This endocrine system has a negative feedback loop. So it's always monitoring, you know, how much do we need of each hormone? So it can feedback and say a little bit of this, a little bit of that. But if we, you know, end up having too much of one thing or the other, it can negatively impact the other one. So it's too much stress is going to massively impact our blood sugars. Our blood sugars out of balance is going to impact our stress, and of course our sex hormones as well. I mean, for anyone out there who's trying for a baby or has gone through trying for a baby and struggled a little bit, how many people have said to you, just don't think about it? And what they're really trying to say is don't be stressed because it can impact it. But obviously it's not always the helpful sentence at the time, but that's why they're sort of saying that as well. So by really looking at how blood sugar and stress can impact each other, I think that's where we will start. So we're going to start with the blood sugar and what kind of happens when we get fluctuation. And then we're going to talk a little bit about, you know, how we can sort of balance that to make it a little bit more balanced. I think it's really important to remind you, and again, if for those who attended last week, I talked about blood sugar quite a bit and saying that it's not something to be feared. Spikes in blood sugars, it should fluctuate. It shouldn't be a straight line. Hormones should always fluctuate. But if somebody's having, you know, eating that sort of Western diet, lots of high sugar, and you know, the foods that aren't nutritious to us, then maybe they've got symptoms and they're not feeling so good, then this is something that we can really look at, particularly cravings as well. And if there's any sort of obesity there. So if you look at this orange line, you can see that it kind of goes up very high and then very low. So this person might have had something like a biscuit, for example, and it's gone very high. We've got a real spike in that blood sugar. This person might be feeling a bit sweaty, a bit thirsty. They might need to go to the toilet for a wee a little bit more often because they're trying to get rid of that excess sugar. And then all of a sudden you get this big drop because you've got all this insulin coming in just to try and get all this blood sugars back into the cells. And then right at the bottom here, you get a bit shaky, you get cravings, you want to have something else to get that blood sugar back up. And actually what happens at this point is cortisol comes in and gets that blood sugar back out because we need energy because there's not enough there. So you've got this insulin and cortisol sort of roller coaster. So you can really see how these two are really quite impacted by each other. Now, the green line is that someone who's perhaps had something, you know, very balanced, lots of protein and fat and fiber in a meal, which we're going to talk about in a bit more detail. But, you know, the Mediterranean diet, which is something that I talk about a lot because that's where the evidence is, because they're getting this nice steady sort of wave, and this person will not have any of those symptoms that we talked about as well. Now, if there is obesity there, this is what's going to really help to stop cravings, stop hunger, and help to lose weight as well. Another thing that can sort of happen with these blood sugar sort of fluctuations, the ones that we are worried about, it can cause damage to the inside of our blood vessel linings. And this is called endothelial dysfunction. So try to sort of think of it as it almost makes it a little bit sort of Velcro-y, so a bit so that it's damaged, so things can sort of trap next to it. And as you can imagine, you might get more plaques and atherosclerosis as a result of this. So these fluctuations in sugar. So the studies show that hyperglycemia, can cause this. So if you imagine that as we get older, our blood vessels get smaller, and if we're eating sort of diet where we've got high cholesterol plus the blood sugar fluctuations, we're soon going to have a bit of an issue with our blood vessels as well. So by getting on control of our blood sugars as well, we're going to be reducing our plaques risk in our blood vessels, and also, you know, risk of atherosclerosis and cardiovascular events. Now, endothelial dysfunction is highly linked to erectile dysfunction as well. So the studies actually show it's quite strong that it's interlinked, and obviously this is what's stopping the blood flow. And there is some really good research to show that actually erectile dysfunction can be an early sign of cardiovascular issues. So if that is something that's happening, it's worth having a chat to the doctor. There's even some statistics to say that potentially erectile dysfunction that isn't maybe affected by psychological mood could potentially be a sign of a cardiovascular event down the line. So that is something that could be really worth having a chat with the doctor about. So these endothelial cells also produce a molecule called nitrous oxide or nitric oxide. And what that helps to do is vasodilate the blood vessels. So you can imagine if this gets damaged, these cells can't produce this nitric oxide. So then you get this sort of lack of vasodilation as well. But something that you can actually really help to do to increase the nitrous oxide is nasal breathing. So what I would really recommend, and we're going to talk about breathing a little bit later. I've got a lovely breathing exercise that we're all going to do together. But by breathing through your nose, research shows that you get more of this nitric oxide as well. So again, if you've got patients that are highly stressed and they've got these other sort of issues with blood sugars and cholesterol, then really trying to notice whether they're mouth breathing or nose breathing or not can be really useful to them. So this is what the balanced plate should look like. Again, I've probably talked to you all about this before, but ultimately it needs to be broken down into sort of four. So half of the plate is going to be your fruits and your vegetables, and then you've got a quarter of it as your protein, and then the other quarter is going to be your sort of root vegetables and your grains. We need to make sure that every single meal has fat, protein, and carbs in it, and every snack as well. And this is going to keep it balanced. And what that's going to do is it's going to help to keep that green line going and that lovely little wave around the baseline of the blood sugars, because protein and fat and fiber slow down the transit time so that you're not getting these like big spikes in your blood sugar as well. So you're going to feel fuller for longer, you're going to have more nutrition, hopefully, and that's going to help with sort of any obesity related sort of illnesses. Now, if you're having snacks, you know, having things like nuts or nut butter with an apple, things like that was really going to help to sort of keep you feeling nice and full. Otherwise, we're going to get that sort of that red line again. Now, calorie intake for men is around 2,500 a day, but that really does depend on activity. You know, when it comes to calories, you need to be able to probably track it on a watch or on a phone or on an app, just to be able to really find out what's going on with your own activity and your size. We don't want to be having any more than 97 grams of fat a day, but we really want to focus on making sure that fat is, you know, monosaturated or polysaturated, and just staying away from those saturated fats. We don't want any more than 30 grams of saturated fat, otherwise that's going to increase that sort of cholesterol risk. And then we want to make sure there's no more than 6 grams of salt a day as well. And we're going to go into that a little bit more detail on, you know, what we can do to look at blood pressure, what can we do to look at cholesterol and heart disease. But, you know, statistics show, and this was from the British Nutrition Foundation, is that actually 1 in 3 men are not eating their sort of 5 a day. So we want to be sort of talking to the men in our lives, or if you're a man listening, you know, trying to get in at least 30 to 40 fruits and vegetables a week, because that's going to be giving you what you need in order to get you all these nutrients that you need. This is a really lovely little tool, because portion size can be quite difficult as well, can't it? You know, and how much do I need? So it's a really nice tool that you can use your hand, so you can use your palm to see how much protein. You can break down the plate, as we've said, but this can help you a little bit with your portion size, you know, making sure that your fat is no bigger than your thumb. And that can really help with that as well. And obviously, really, like we're going to talk about mindful eating and chewing and that feeling full as well. So what's going to help you with blood pressure and cardiovascular and cholesterol is looking at the risk factors, and, you know, with some gusto, like really getting these risk factors sorted. So nutrition, trying to lose weight if there's any obesity, smoking and alcohol, and all of that will really dramatically impact the risk of any high blood pressure or cholesterol, cardiovascular disease. There's some really fantastic resources on the British Heart Foundation website, and it breaks these all down really nicely into sections. And I quite often send, you know, that particular link to that page to a patient. I'm going to talk a bit about later, but we do health screens for our patients as well. So if we do notice there's maybe a little bit of high blood pressure or high cholesterol, we can then I then send it to them via an email, so they can have a little bit of a read about it as well. So blood pressure, so we do want to be thinking about, you know, eating lots of fruits and vegetables, because that's going to have potassium in, and potassium is really great for helping with the vasodilation of the blood vessels. But we don't want to be taking it in a supplement, so we really want to be able to having that potassium sourcing to help regulate that, not vasodilation, to regulate the blood pressure. And that's just in your fruits and vegetables. There's some really nice research about beetroot. I don't know if anyone has read about that, but a lot of athletes are using it now to improve performance and also for recovery, because that's got nitrates in it. So if we're eating food with nitrates in it, then that's going to increase the nitric oxide that we talked about earlier as well. So nasal breathing and trying to get fruits in with nitric oxide can really help. And that's in like things like spinach, celery, kale, bananas, strawberries. So having some of that in your diet as well. You know, if we're trying to fill that plate up with that 30 to 40 fruits and veg a week, we are going to be getting the things that we need with regards to that. So all of these things, and eating your fruits and vegetables and this Mediterranean lovely plate that we talked about, will help with, you know, low cholesterol as well. But there's some nice research behind beta glucans as well. So beta glucans you find in oats, rye, barley, and in some of the mushrooms as well, like shiitake mushrooms. And yes, they're a great source of fiber, and the research behind fiber is fantastic for preventing cardiovascular problems, but also helping with weight loss. The research sort of says that we're all about having about 10 grams too less. We should be having about 30 grams a day, and the research says we're all having about 20. So we want to try and boost that up a little bit. But these beta glucans, they kind of go around and they mop up that LDL, that low density cholesterol, the one that causes the problems as well. So by trying to get some of those in your diet. Now, I've just spoken to you about balancing your plate. So when you're having any oats, then I do ask that, you know, if you're having that for breakfast, just try not to get the ones that are made with golden syrup or, you know, full of sugar, because we don't want to be getting those spikes in sugar. So we're having your oats and making sure we're pairing those foods really nicely as well, because we are thinking about the blood sugars. So, you know, adding those nuts in, adding some flax seeds, anything that you can for like adding a bit of protein and fat and fiber. as well, so nuts and seeds. And then another thing that sort of came up in the statistics that is that men eat quite a lot of red meat or processed meat every day. So trying to avoid that and switching it can be really useful. With regards to sort of sausages and things like that, switching from, if you do eat meat, eating from pork, moving from pork to turkey can make such a difference. If you have a look at the difference between the calorie intake and the fat intake between a pork sausage and a turkey sausage, that can make such a difference. And these are the things that we want to make little changes in if we're doing them every single day, because they're going to be the ones that make the most consistent change. If you only have, you know, a cooked breakfast once a month and you really enjoy it, it's not going to be as impactful as if you have a sausage sandwich every single day. So now we're going to talk a little bit about stress. So we're going to talk about the central nervous system. So we know now that stress, the adrenal glands produce cortisol, which can impact the other hormones as well. We know that it impacts our blood sugars. But what research sort of shows is if we're highly stressed, we use up way more of our nutrients than we are sometimes putting in, and we need to put in more. So we need to make sure that we are really managing our stress levels as well. Now, it also impacts our digestion. As you can see on the top here, the parasympathetic nervous system, this is our sort of rest and digest mode. This is our calm place that we need to be before we're eating, perhaps. When I show you that breathing exercise, this is what we're doing. We're engaging into our parasympathetic nervous system, but it stimulates saliva flow. And what we need to do to start our digestion is chew our food, and we need to have a good saliva flow in there. So if you're feeling, you know, very stressed, engage that parasympathetic nervous system, stimulate that saliva, stimulate that activity of the stomach and the intestines, is really going to help you to digest and absorb your food. But it also affects how we get rid of our food as well. You know, if we're in the sympathetic system, which is our flight or fight mode, where we're breathing very shallowly and we're stressed, we're potentially going to be going to the toilet a bit too quickly, meaning we won't absorb so well, or perhaps it might slow us down sometimes as well, and then we might get risk of sort of stagnation and then risk of sort of problems with the gut as well, which we are going to talk about shortly. So this is the vagus nerve. So vagus nerve in Latin means wandering, and basically that's because the vagus nerve is so long, and it's our connection between the brain and the gut, and it's the first part of the digestion. So before we have breathed and stimulated our saliva flow, we want to get this vagus nerve stimulated, and we do this by smelling our food. And you know, if we haven't prepared it, and again, when I was sort of writing this, I didn't want to think I was stereotyping anything, but if you do have your food cooked for you, you might not be able to have that process of preparing your food, and you don't then have that sort of digestion going because you're not smelling. But you might be someone who goes to lots of meetings and lots of meals, and you don't prepare your food in that sense. So when you're doing it, try to smell it, stimulate that vagus nerve, get those juices flowing, and then you can get on to the next part of digestion, which is the chewing side of things as well. And yeah, nasal breathing is the way to do it. So also what can keep a vagus nerve healthy is humming and singing and cold showers. So I always say screaming in a cold shower will help with that. So this is a breathing technique that I recommend to absolutely everybody. I do it, it's something that, you know, you're going to get that nitric oxide increase, you're going to be managing your stress levels. You soon see how important this is going to be for testosterone levels as well. And it's something you can do whilst you're working, whilst you're driving, when you're on the loo. Really good to do if you're about to respond to something that you need a moment for. And also adding ceremony to your food, just to try and slow down, chew that food to a pulp so you can absorb it and get that breathing in. So I'm going to do it with you now. So if you just breathe in your nose for 4. So breathe in your nose for 4, 2, 3, 4. Hold for 1, 2, 3, 4, 5, 6, 7, and then breathe out your mouth for 2, 3, 4, 5, 6, 7, 8. I kind of wanted to do that with you, but I do that all the time, and there's lots of research behind it, and it's even really linked to sort of lowering blood pressure as well. So I would get you to teach everybody that you know that as well. And feel free to keep doing that for the rest of the presentation if you like. Recommend doing it 3 or 4 times before eating, but if you've had a particularly stressful morning, you know those times where you eat something and you look down and your food's gone, just to try and bring you back into a bit of center, because if we're not absorbing our nutrients, we're not going to be having our body working in the way we want it to. So I just wanted to show you some nutrients that really support the central nervous system, these good mood foods. So vitamin C is really vital for the function and physiology of the central nervous system, and it supports all of the processes of it. So this is all your colourful stuff, your brightly coloured fruits and vegetables, and you're going to be having your vitamin C in that. And then we've got omega-3 and fatty acids, absolutely supporting the structure of the nervous system as well, and then B vitamins. So again, when you look at this, when you look at these 3 pictures, you can just see that is the Mediterranean diet in itself, or it's that plate that I showed you at the beginning, isn't it? So, you know, every time you have a look at that, it's going to be supporting your gut, it's going to be supporting your central nervous system, and it's going to be keeping you fuller for longer just by applying those simple rules and getting all of those nutrients into your body. Now, just to sort of stay on a little bit of the gut, I could talk to you about an hour about the gut, and I'm only going to whistle stop tour around it, because I just think with, you know, what we talked about with the suicide rates and the depression link, that it's really important that we do talk about it before we get on to the testosterone. Because really what's happening in our gut can directly influence our brain function and our behavior. It's strongly linked to depression and anxiety as well. We've got our hormones in our gut, you know, for melatonin, so our sleep hormone. We've got our neurotransmitters like serotonin, which is our happy sort of hormone, or dopamine, which is our feel good. And all of that can be, you know, impacted by dysbiosis, which is sort of, you know, infection or, you know, the wrong bacteria in the gut as well. And there was actually a study that showed that there is a reduction in both the diversity and total amount of healthy microbes in the gut of those who suffer with depression. So, you know, it's definitely worth thinking about, you know, what is the gut health like as well, and what impacts the microbiome negatively. And it's all the things that we should avoid for other parts of health, you know, so things like poor diet, high sugar, for example, high stress can really impact it as well, smoking, alcohol, and of course medications as well. And of course we talked about at the beginning, you know, that we said that men are more likely to, from the statistics, are smoking and drinking, so it is quite relevant to that as well. So we're getting a theme now with these pictures of these foods. What does the gut need? Again, it's the same sort of foods. You know, we want to make sure that we are following that plate with that Mediterranean diet. We've got that 30 to 40 fruits or vegetables a week, not a day, because we set ourselves up for a day to try and have an amount we can set ourselves up for a fall, and it can feel quite negative. So I think having a weekly amount is a really good way of doing it. But all that fruit and vegetables, they're going to be feeding the gut bacteria, so it's prebiotic, so it's going to be feeding it and repopulating it and helping that population to stay. Also, we want the pulses and the fiber, because we want to be keeping things moving and releasing any toxins. And obviously the fats are amazing for supporting anti-inflammatory, and if we're supporting our central nervous system, we're supporting our gut too. Now, we can add a few sort of life cultures into that as well. So again, you can have things like kefir or kombucha, and this is without sort of supplementing. So these are life cultures that we can put into the gut. So probiotic is like a life culture that you place there, and prebiotics are what you feed them to kind of keep them there as well. So that's kind of like working both together. So it depends on whether you like those kind of things, or you know, whether you want to take a supplement if you feel you need to. But I would just say, if there's any gut issues, I would speak to probably a professional before taking lots of supplements. And also as well, before we move on from the nutrients, we want to be sort of really, you know, mindful eating, make sure we're nasal breathing and chewing, and that's going to cover our sort of gut health. So testosterone. So this is the major sex hormone in males. It helps to maintain muscle mass, bone density, sex drive, sperm, blood cells. So a really big role in blood cells. So low testosterone can cause problems with anemia. It's made in the testes, but some of it's made in the adrenals as well. So you can soon see how, if we have a problem with either of those, that they can impact that production as well. It relies on fats to form its structure. So if we're not having these fatty sort of acids in our diet, we're not going to get that structure of our testosterone as well. So you can find that sometimes in restricted diets, whether it's a low fat diet or it's vegan or vegetarian that's got low fat, that can actually cause low testosterone as well. Obesity actually causes low testosterone, and that's because some of the various mechanisms disrupt the cells that make it. So again, if we've got a problem with testosterone, then trying to sort of look at sort of obesity can really help with that as well. And obviously that's going to have that massive link in with the, you know, the cholesterol and the blood pressure and cardiovascular risk as well. What could that result in? So symptoms can be like sexual dysfunction. So again, if we do have erectile dysfunction, we know it might not always be a cardiovascular issue, it could be a testosterone issue as well. And that's something that would need to be obviously spoken to with a GP. but it can include muscle loss, fatigue, depression, cognitive decline, an increased risk of cardiovascular diseases. So again, if someone has got obesity, and this is all kind of like compounding into sort of one problem, and diabetes as well. Now, high testosterone is rare. It's often seen with people who maybe have had anabolic steroids use, or it can be genetics, or perhaps it could be something like a tumor that's in either the testes, the adrenal glands, or the pituitary gland, which is kind of where they're all produced. So how can we boost levels naturally? So there's some good research to show that boosting weightlifting can really help with that as well. Now, it can't be just in short term, it needs to be sort of ongoing, because it's the muscle composition ultimately that really helps with that. And vitamin D as well. So vitamin D is really important with the production of testosterone as well. Now, what I would say is, don't take the supplement blindly, because it's a fat soluble vitamin. It's stored in the body, so we need to make sure we know what the baseline is as well. I think it's probably quite common that a lot of people are low in vitamin D with the Western world, the way we work, and the sort of lack of sunshine that we have, especially recently in last sort of year. So I would recommend getting your vitamin D levels checked. If you want to take sort of a maintenance dose, that's absolutely fine, but try not to take too much of a therapeutic dose without knowing what your baseline is, because it can be harmful. Sleep can massively impact testosterone levels as well. Just as much to say that I was listening to a podcast by a doctor who is an endocrinologist, and he was saying he wouldn't take a blood test to check testosterone if someone hasn't had a good night's sleep the night before. Obviously, that would be sort of short-lived, but when that's sort of consistently an issue, then that's going to kind of impact the testosterone levels. And then what can actually happen is the testosterone goes low, cortisol goes up, and then they have even more sort of sleep problems, because they've got this sort of, high cortisol situation as well, and it can become a bit of a vicious circle. So again, that's something that could be really looked at when looking at testosterone levels, and, as a preventative measure, just trying to get the good night's sleep in. There's a really good app called Sleep Station, and it's by the NHS, and that actually it's almost like having a sleep coach, which is really good. So if you genuinely have tried all the sleep hygiene, where you're not having the room too hot, you're not having caffeine too late, you're not looking at screens, and you tried all that sort of generic stuff that's going to help you sleep, then maybe just going a little bit deeper with something like that could help as well. Now, if you go onto the website, it does have funding in certain areas with doctors, so you can put your postcode in and see if you can get a free one as well. So it's a really good resource to share with patients as well, that one. And then with regards to nutrients, so we've got zinc, we've got magnesium, and we've got fat and protein. So we need to be making sure we've got all of those in our diet. So zinc is going to be in all your nuts and your seeds, your shellfish, your lamb, green leafy veg. So, green leafy veg is the answer to everything in any nutrition question in an exam, by the way. So always assume green leafy veg is good for you. But the same with magnesium. Magnesium's got dark chocolate as well. But in all of these sort of sources, green leafy veg, your nuts, your seeds, your beans, all of that kind of thing, and your animal products. And then the fats, we want to be making sure that they're not saturated fats as well. So if you're, again, looking at that plate and those pictures that I showed you of just the kind of way that we need to balance our food by making sure it's, half vegetables, we've got our grains, we've got our protein, you're going to be getting all of these things in. You don't need to go away and now think, oh, I need to put something in with zinc in every day, because the likelihood is, if you eat that way, you will have more than enough zinc and magnesium that you need, unless you are, like I said, really stressed and using up more of your nutrients. But then that's something to look at the stress levels with as well. So testosterone declines naturally from the age of 30 to 40, about 1 to 2% per year, and just goes very slowly. It's not the same as sort of women with estrogen. That's why you can sometimes hear of men in their 80s still being able to have babies, but it just very slowly declines. But if there is an issue there, then I would highly recommend going and speaking to the doctor about it, rather than trying to work it out yourself. Especially with some of those really sort of life impacting side effects that you can get, I think it's just really worth having those conversations. So the male menopause, so also known as the andropause, or hypergonadism, and that's, or late onset hypergonadism, because it is something that can be born with as well. But the male menopause is something that can happen, and you can see on here from early 40s to 50s. You can see what some of the symptoms are as well. But I was very surprised to see actually that on the NHS website that they called it midlife crisis on the NHS website, but maybe that's kind of what they kind of link the symptoms to is when men are feeling that way halfway through their life. Massively affected by diet, lifestyle, smoking, alcohol, lack of sleep, like we mentioned, because it's that decline in testosterone. And, you know, how they also describe it is that these symptoms can interfere with everyday life and happiness. So about 1 in 200 men can experience this. So it isn't overly, you know, it doesn't happen to everybody, but it's definitely worth knowing that it's something that can happen. What to look out for. So maybe men that are, you know, 30s to 40s and they are getting fractures, because they might get, so osteoporosis in men is very rare, but when they've got low testosterone and they've not got that sort of protection for their bones, they can get sort of fractures. So that's something that a doctor might look out for. And also low iron with no explanation. So really low iron, but nobody can really know why it's sort of happening. That can be an indication that this has perhaps happened. Now, they can have HRT to help it, but only following a blood test and obviously with sort of a doctor's sort of support as well. So that is the male menopause. We're going to talk about the prostate now. So this is the walnut-sized gland located near the bladder next to the rectum. It surrounds the urethra, so it helps to transport urine from the bladder and also has a role in sexual production, so the sperm. And just before we start, so I found this sort of article on Men's Health. It's like the best foods to eat for prostate health, because I've seen a lot of, you know, information out there of potential nutrients that can really help with it, but how much research is behind it? And you know, we don't want to be giving out sort of false information that could lead people to sort of have the wrong idea. But what the main sort of foods that came up with it was lycopene, for one. So that is a phytonutrient in tomatoes. So anything that's kind of red can help to keep prostate healthy. Cruciferous vegetables, so that's like your, you know, your broccoli, your cauliflower, and your kale and things like that, because that can really help with supporting. It's very anti-inflammatory. It can support hormonal health as well. Pumpkin seeds, because they're full of zinc, so I liked that one because we know zinc and testosterone is interlinked. And according to the National Cancer Institute, pomegranate has been seen to restrict growth of prostate cancer cells. And then we've got berries, we've got green tea. So when I really looked at all of these, there's one common denominator between them all, and they're all antioxidants. So antioxidants, we know, have sort of cancer properties with them as well. And we're going to talk a little bit more about antioxidants and how they work next. But that seems to be the main sort of thing behind these foods that people are boosting. So they didn't talk about Brazil nuts, which I obviously know selenium is in there, and selenium is a powerful antioxidant, can help with prostate health, but there is some contradicting information out there. You shouldn't really take it as a supplement because actually it can be harmful. So what I was always sort of taught at nutrition school is 2 Brazil nuts a day. There's a little bit of selenium in there and that can help. But what I also found out that was the Brazil nuts need to be from Brazil because of the soil quality there. So they're more likely to have selenium in them if they're from Brazil than rather the ones that might have come from China. So if you get Brazil nuts, make sure that they're from the right place, and that will they'll have that selenium in there. So how does an antioxidant work? So again, forgive me if you were here last week and you've already seen this, but for those that aren't here, it's really useful to understand why antioxidants and replenish them is so important. So we've got our stable molecules, our molecules which turn into cells, have electrons. Electrons come in pairs, and when they're in pairs, they're happy, and then they go on to you know, turn into a healthy cell. A free radical can come along from, you know, a harmful product, and it has an electron that isn't in a pair, and it wants to steal one from our stable molecule, and then it will render our stable molecule unstable, and then we'll have a problem with our cells, and that will be unhealthy. So we've got our antioxidant that's got an extra electron that wants to lend it to the free radical, and then that will render that free radical stable, and it will leave our stable molecule alone. The reason why I like to tell everyone about this is because once that antioxidant is used up, it has gone, and we then have to replenish it. So it's just really, really important with antioxidants that fruits and vegetables, we keep putting them in our body so that we can replenish them. So antioxidants are in all of our colourful fruits and vegetables, and vitamin E, and obviously in our selenium as well. And also sulfur is really good for creating this master antioxidant in our body. So it creates glutathione. So be eating things like onions and garlic, mackerel, it's all the smelly stuff, eggs, is a precursor to this glutathione. So eating those kind of things as well is going to really help to boost your antioxidant status. I think what's really interesting to know with antioxidants is they're only going to work if there is oxidative stress there. But I think we do have a lot of that around us with the way that we work and with our stress and with our harmful byproducts of, inflammation. And so there's always going to be room for having antioxidants in our body. I just wanted to share this with you as well. So this is actually an episode that you can listen to on Spotify if you've got Spotify, or you go into the doctor's kitchen. And it's all about endocrine disruptors and the impact it's having on male sperm. This is this lady's book, Shanice H. Swan. She had this study in 2017, and she was just saying that basically we've had a 50% drop in sperm count over the past 4 decades, and that is going to continue over the next sort of 4 decades. And she kind of predicts from her research, and I think in 2017 it was one of the biggest studies. It had quite a lot of attention, and it kind of blew up for her. And she's predicting that a lot more people are going to need to go on to IVF because of this problem. So looking at endocrine disruptors and the chemicals around us can make a real difference to sort of sperm health as well. So that's her book. Feel free to, obviously have a bit more of a read or listen to that episode. So endocrine disruptors, how do they work? So, we've got our hormone receptors, and our hormones like lock in like a key. But what an endocrine disruptor can do, it can come in and it can lock in just like the hormone. But what it can do is it can inhibit the hormones way that it works, or it can also actually give it a more of a more virile sort of action of the hormone as well, so it can actually cause more of a problem. So these are things that you'll find in like plastics and the chemicals that we have around us, perfumed things. The research is really strong in perfumed things that we wash our clothes in or put on our body. Again, so for men that are working in trades, perhaps they'll have a lot of this sort of stuff around them. So it's about looking at what you can reduce where. I always say, when we're working in the dental practice, we can't stop doing cross-infection, but I can perhaps stop putting that really perfumed cream on my body at night time. So that kind of thing is about looking at, do we use a plastic bottle? Do we use a glass bottle? Do we heat up plastic Tupperwares in the microwave that can release BPAs? What pans do we use to cook? So the kind of things that we use all the time. What foods are we eating? Have they got pesticides on? So instant coffee is really high in pesticides often. So, by just changing up, maybe because I have coffee every single day, so I always get sort of, organic coffee that I feel more confident that doesn't have the pesticides on to drink, knowing that I've reduced that sort of in that sense as well. So having a look at what's around you, because if you are a male trying for a baby, it takes 3 months to make a healthy sperm. As a nutritional therapist, if I was working with someone on sort of fertility sort of side of things, we would want that at least 3 months to be able to get that sort of that time to get that healthy sperm going. But it's also the same with an egg as well. How do we keep sperm healthy? Well, we don't want it to be too, we don't want testicles to be too hot. So, if you're doing a lot of driving, trying to wear sort of loose clothing, that kind of thing can help. And doing all of the things that I've said in this webinar, avoiding all the risky substances, eating all the fruits and vegetables, and balancing your plate, and losing any excess weight that might be causing any ill health. All of those things are going to really, really help, as well as obviously looking at things like the endocrine disruptors as well. So now I'm going to bring you back to Bill. I just thought, with the statistic that we talked a little bit about, having this conversation and us being a really fantastic port of call, how can we help Bill to feel confident to go and talk about his health? So what kind of things will we see? So I do a health screen as part of my appointments at the dental practice that I work at, and we look at things like triglycerides, cholesterol, blood sugar. I've got a little ECG to check the heart rhythm. I do blood pressure as well. And we've got like a traffic light system. And that is a really nice tool to signpost as well. I obviously showed you a picture there of sort of visceral fat in the middle. I do a hip to waist ratio measurement and use a calculator, because that's a really nice, respectful way of being able to tell someone they've got visceral fat in the middle. Now, I don't jump on people with this when they walk in. They signed up to it as part of their appointment. They know it's coming. So I don't just stop measuring someone when they come in to see me for a hygiene appointment, because they probably never come and see me again. But they sign up to it, and it's just a lovely little way of getting getting to see things that perhaps might not have been discovered. We've had quite a few people who've been signposted onto a GP for blood pressure. I've also had another patient who felt like they had high blood pressure, but they weren't getting with their doctor, and their appointment with myself and with their optician, with the information that they got from both appointments, actually got their doctor to listen to help get the help that they want as well. So that visceral fat in the middle is almost like a organ in itself. It's really active. It's got a lot of inflammation in. So all the research shows that if you've got that visceral fat in the middle, there is more of a high increase in the risk of cardiovascular issues as well. So that's why, again, you can see it on your patients, but it's rude to point something like that out. So you wouldn't do, but you can do it in a different way. Other things that you might see in your patients, so skin tags. So patients who perhaps have high blood sugar balance issues, frequently might have skin tags. So the NHS says more than 3 a year could be a blood sugar type 2 diabetes risk, because basically you're getting extra tissue due to cell proliferation. So you're getting extra tissue grow, and it's acanthosis nigricans also as well. So this is often seen like in the neck or in the armpit or around the elbow. So you're more likely to probably see it on women because they wear sort of, vests and things in the summer, but you might see it on a neck or an elbow on your male patient as well. So that's the kind of thing that could maybe you could see that, and you could see the weight in the middle, and you could say, oh, do you have any sugar cravings? Do you have any night sweats? Do you have a dry mouth? Do you, and if you feel comfortable, do you frequently urinate? That kind of thing. What are your energy levels like? Do you have any energy dips? Are you stressed? All of those sort of questions can come from noticing these things, and you don't have to say to someone, oh, have you got a new skin type, or I can see you've got some weight in the middle. It can kind of lead you to then have those sort of questions with them as well. Also, this one, you can never say it, but xanthelasma. So this is cholesterol spots. So I actually had a male patient just before Christmas have 2 really large ones just on the eyelid, very symmetrical. And I did actually mention to him that studies can show that 50% of these could be a sign of hyperlipidemia, which is, I didn't say hyperlipidemia to him, but high cholesterol in patients. So it could be completely harmless, or it could be a sign of high cholesterol. This patient had quite a lot of weight around the middle. He was saying that he wasn't feeling particularly great. So for me, I thought maybe perhaps there was a sign that I might be, but obviously I'm not there to diagnose, so I can't. So I just pointed him in the right direction, and he's going for a blood test, and I'm going to follow up that soon and find out what his results were. He was actually quite worried about it, and I didn't enjoy worrying him, but I did reassure him it can be harmless. But he was quite a young man, and I just felt like if I didn't say something and it was, then that's not that making every contact count. So I just felt that I needed to say that to him. So functional testing, so vitamin D for sure. There's a lot of your patients are, even yourselves can find it hard to get in with the GP sometimes. So there's a great test called vitamindtest.org, and they use an NHS lab. So again, they're really great, reliable source, and they can send you a report on what your vitamin D levels are. And then they do actually signpost at the bottom who to go and see to and what to do. Obviously checking blood pressure is always going to be really useful. Testosterone for blood tests. So yeah, absolutely. If you feel like you've got any of those symptoms, or you're worried about your testosterone, getting a blood test, but do it after a good night's sleep if you can. HbA1c to check blood sugars. So obviously that is like over 3 months. So that's really showing what's going on. The glucose piggybacks the red blood cells, so you can really see what's been going on there. Cholesterol, so the cholesterol that I do in my health screens is a total cholesterol, so it's really not a great picture of it, but if it is high, it helps to signpost for looking at the ratio of low to high. Triglycerides, this is fat lipids in the blood, so high cholesterol, high triglycerides, and blood sugar balance issues is all going to link to type 2 diabetes risk. CRP, C-reactive proteins, that's something sometimes a GP might want to check if he's worried about any inflammation in the body. And homocysteine, so the homocysteine is a amino acid that is present in the blood on very small levels, but when it's high, it can cause damage to the blood vessels, and it can be an indicator of cardiovascular events. And actually, one of the things that can cause it to get high is low folic acid and low B12. So actually, by checking that as well, you can see if those vitamins are low as well. Now, If that is high, then yeah, there are some elevated risks, but they can make it better by addressing those vitamins as well. And, you know, what would cause your vitamin Bs to be low? Well, drinking alcohol for one, especially B12, any absorption issues with the gut, really high stress as well, because, you know, could be vitamins like the stress vitamins as well. So, you know, it's, or not even, maybe just not eating a range of nutrients as well can contribute to that. So a little bit of a chat about supplementation. So I had a little look around at, you know, testosterone boosting supplements, and, you know, the claims aren't supported. There's not really any academic literature to say that they can work. And there's lots of people out there who say that, you know, anecdotally they do. But the one thing that I kind of got from my research is that you shouldn't really take testosterone unless you need it, because it can become harmful if it's too high. And if you don't need it, it's not going to help you, you know. And potentially some of them may not have therapeutic doses in to help. So you're spending a lot of money perhaps on something that isn't going to be helping you. Potentially antioxidants can be a really good one to take if you're trying for a baby perhaps. But, you know, if you are getting in all those fruits and vegetables, you know, if you are a smoker, you do need 35 milligrams more of vitamin C a day. So a vitamin C supplement in that sense could be really useful. Obviously, we would want people to stop smoking, but it's not always that easy, is it? Magnesium, so magnesium could be great. You can absorb it transdermally, so you can put it into a bath if you want to, add a bit of ceremony to your evening and work on your stress levels. Omega-3 if you're not having any source of omega-3 at all, because again, that's just really supportive for cardiovascular system and central nervous system, anti-inflammatory. But again, I would probably, if you want to start looking at supplements, you feel like something's lacking, I would say talk to a nutritional therapist, or, you know, if you've got any concerns, your GP. I put a blue crest on there because there's companies like that do sort of health screen checks as well. So they'll take like a full blood check. You know, if you're someone who doesn't want to go to the GP or you struggle, there are other ways that you can do it. I have had Vitality Health as well. You can get medical care on there, and you can go to these sort of health screens as well. So there's lots of ways out there of accessing support if you struggle with going to the GP, for example. I put BANT on there because that's the British Association of Nutritional Therapy, because you can actually learn to be a nutritional therapist in a weekend, because it is not regulated like dentistry, for example, whereas I had to study for 3 years and do 200 hours of clinical observations, being observed and observing. And so if you go onto the BANT website, you can go on there and you can find a practitioner that has studied to the level they need to be trusted with your health and your life and your body. So, and also as well, you can send that to patients and they can find people in their area, or perhaps people who specialize in certain things as well. And I just wanted to leave you with this. So, you know, we always, as girls, you know, I can remember being told to check your boobs all the time and have a feel. And if you are someone who doesn't go to the doctor or check, or you don't want to bother your doctor, you know, please be looking after your own health. Go onto their website. There's a great video, shows you how to do it, but find out what's normal for you, and check, and encourage all the men in your life to be doing this kind of thing as well. And then that kind of just leads me to the end. So thank you so much. I hope you've enjoyed listening. I feel like I've covered an awful lot this evening. As always, it's a whistle stop tour. So yeah, I'm happy to answer any questions anyone might have.
Thank you very much, Nina. Can I ask you, you know, like the disruptors, the endocrine disruptors, what do you think about washing up liquid and the likes, and washing up tablets and all of those?
Yeah, so all of the studies that I've read, because obviously I've researched this quite a bit for women's health as well, it's the highly perfumed stuff that's going to cause the most sort of issue. So that is stuff that we wash our clothes in and wash our bodies on, and, you know, as well. So it's about looking at other sources of those kind of things, because they're kind of things that you use all the time, aren't they?
Yeah. I just noticed a lot more advertisements for the different alternatives.
Yeah.
So I'm kind of looking into it a little bit more. I was just wondering what you thought about it.
There's an app, I think it's called Yucca, I think it's called, and you can go on there and it has like a sort of traffic light system of what sort of they consider to be good and bad with regards to chemicals as well. There's lots of shops, isn't there, going now, where you can go in and you can get refills, and it's often lots of more natural stuff.
Yes.
I always tell people about what I do with coffee grains. I think I've told you about this, haven't I? But, you know, when I've made my coffee, I'll use the grains, mix it in with some oil and make a body scrub. So I'm reusing it, but I'm using something that's very natural as well. And these are things that you can use all the time. So yeah.
What is beetroot juice good for, please?
So it's got nitrates in it, so it's going to help to boost that nitric oxide, but it's actually really fantastic for the liver support as well.
Okay. Any more questions there for Nina? It doesn't have to be about men's health, actually. It could be about women's as well. Could it,
Yeah,
Nina?
it can be about anything, yeah. And also, I'm also happy, you know, if anyone thinks of something later, or you're watching this on demand and you have a question, you can always reach out to me. I put my email just there, actually. I was just about to say it, but it's on the screen.
Yeah. Yeah, so email Nina is very helpful. We all tap in and ask you questions all the time, don't we, Nina?
Yeah, I love it. You know, I often get people questioning, sending me a message about a patient they've seen, you know, or you sort of themselves.
Yeah, and a lot of our colleagues refer patients to you, don't they, Nina? So that's very helpful as well.
Yeah.
So just while we're waiting for it to see if there are any more questions coming in, an evaluation will be sent out. Please check spam and the junk folders. There's some of them seem to go astray. And then you fill in that evaluation and the marketing will send you your certificate. On demand, it will be produced straight away. So just to repeat that again, evaluation will be sent out in a few days' time. Just check for that, fill out the evaluation, send it back, and then the certificate will come once that's filled in. Where can I train in nutrition?
That's a really good question. So I went onto the BANT website. I'm always talking about the BANT website, but they have courses that so I really wanted to be on the BANT website because it's like the GDC. I'm regulated and it gives me credibility. So for me, I wanted to be on there. So they've got a list of courses that they approve in order to be able to be registered on there. So that's be one way to go. But if you wanted to just sort of dip a toe in, there's lots of nice little diplomas around as well, which I'll be happy to sort of share. I'd have to look them up, I'll put them on the page, but there's lots of people doing courses. But if you wanted to go and do the full qualification, I would definitely say go onto the BANT website because, you know, it's nice you also have the support of BANT as well.
Very good. Any hair loss tips?
Hair loss tips. So there's a few reasons why you can have hair loss. So is this for, well, I'll just say, so hair follicles are kept healthy by omega-3. So having omega-3 is really good. If you're really someone who gets hot and sweaty a lot, that can impact the hair follicles as well. So people who exercise a lot have noticed it sometimes. Low iron in women can cause male patterned baldness as well. So be worth looking at nutrient status, but never take iron without knowing what your baseline is again, because we store it in the body, so we wouldn't want to take it without knowing. But it depends on what the if I answered the question.
I think so.
Yeah.
I wonder, is there a downloadable nutrition leaflet to give to patients, please?
I should make one, shouldn't I, Siobhan?
Yes.
Maybe watch this space.
That's probably a good idea, isn't it?
Yeah. I have got a few things that I have put together with pictures like from my my webinars and that as well. So maybe I could put something on the Ikigai page.
Great. Well, I think that's it, Nina, really. If there's anything else you want to add to it, and we've just 2 minutes left.
No, I just hope you all enjoyed it. I hope that you all get something from it. I know that, you know, I think with these webinars, isn't it, when there's a lot of things, some things really resonate and other things you think, oh, I'm doing that. And, you know, so I just hope that you all enjoyed it.
Yeah, it was absolutely fantastic. Thanks very much, Nina. And we'll get you back later on in the year, if that's okay.
No problem.
Okay. Thanks very much. Good evening, everybody, and thank you for joining us. We'll see you again in a few. Oh, we just have one more before we go. Oh, excellent. Thank you very much, Nina.
Oh, thank you. Thank you.
Okay. Right. Take care, everybody. Good evening.
Good night, everyone.